Hello, I'm Professor Stan Becker in the Department of Population, Family, and Reproductive Health. I'm going to tell you about some new research done by colleagues in the department in the Population and Health group. First of all, we see in this graph a plot of the horizontal axis. We have the proportion of women with unmet need for contraception, and the y-axis is the proportion of women who report having sex in the last 4 weeks. And each dot is the data from one demographic and health survey from about 67 countries around the world. We see a negative relationship, and Professor Bishai has estimated that for each 5% decline in unmet need, we have a 5% increase in the percent of women who reported having sex in the last 4 weeks. What does this mean? Well, nobody really knows. There are no real statistical adjustments that have been done, and there could be reverse causation, but it deserves further exploration. Next, I'd like to talk to you about the work of Professor Court Robinson, who studies migration. It has been estimated recently that 57,000 children from Mexico and Central America have crossed the U.S.-Mexico border since last October. How many of these children have relatives in the U.S.? What is the age distribution of these children? How many of them are refugees? These are questions that we don't really have good answers to. Professor Robinson is studying this, working with Save the Children UK and Child Protection Working Group to help estimate the number of unaccompanied children in such situations. In this graph, it's quite complicated compared to the first one I showed you. This one shows the estimated years of schooling for children of mothers for various characteristics, various risk factors they had of the birth of those children. And these data are, as I say, quite complicated. They're linked also from demographic and health surveys, but over time to trace cohorts. So we have the demographic and health surveys started in the 1980s, and they've gone through, and they're about every 5 years in some countries. So we're able to link the cohorts of mothers and their children. And this shows that for the risk factors of young age or short birth intervals or high parity, that if all three of those were eliminated, then the children of those mothers would have on average about 2 years more of schooling than if within those risk factors are present. This is, as I say, quite complicated analyses to link cohorts across time. Finally, I'd like to tell you something. We're just starting with the Energy, Environment, Sustainability, and Health Institute at the other campus, the Homewood campus, and our Gates Institute, looking at the effects of population on the environment and vice versa. There was a study done in 1972 by MIT professors called Limits to Growth. That has been updated, and we see in this slide their estimates from 1972, and the population estimates are right on for 2004 when this was done. And the interesting thing about these projections is that they take into account the environment and ecological factors. And some people believe we're in overshoot, that we are using our resources faster than they can be replenished, and that there will be a crash of population, mortality will increase. And we're hoping to study the equations for this specifically for Africa, not globally, but for Africa, where we believe there will be problems in terms of feeding the population and that sort of thing. And so we're just starting this work. So in all four of these, we hope you stay tuned and find out further about our research as it progresses. Thank you for listening.